He is awake. 3 people hold his head still. A sharp stone touches his skull. There is no hospital, no scanner, no modern anesthesia, and person holding the tool is about to remove part of his skull. The shocking part is not that ancient humans tried this. The shocking part is that some patients survived. This procedure is called trepanation. It means making an opening in the skull by scraping, cutting, or drilling away bone. It was not modern brain surgery. They were opening the skull, not operating on the brain the way surgeons do today. So how did anyone survive? The first answer is simple. They learned where to stop. The safest openings did not go too deep. Ancient healers could remove bones slowly and avoid damaging the delicate layers underneath. And one method seems to have worked well: scraping. Instead of cutting straight through the skull, a healer could scrape away thin layers of bone little by little. That gave more control. But here is the part that changes the story. They were getting back better. Researchers studying hundreds of trepanned skulls from Peru found a change over time. In some early groups, about 4 in 10 patients showed long-term survival. Centuries later, some groups reached around 9 in 10. That does not look like random luck. It looks like learning. Some parts of the skull were more dangerous than others. Some techniques were safer than others. Scraping often worked better than drilling or cutting straight through, and successful healers seem to have learned to avoid areas where one bad move could cause heavy bleeding or deeper damage. They did not need a medical textbook, they needed results. One patient lived, another died. Someone noticed the difference. The next healer changed something. That memory became skill, and that skill could be passed forward. This connects directly to our last video about ancient injuries. We saw that a badly injured person could survive because the group brought food, water, warmth, and protection. But now the group was doing something more dangerous. They were turning memory into surgery, and that raises another mystery. Why would anyone open a human skull at all? There was probably no single reason. Some skulls show head injuries, so trepanation may have been used after trauma. Other cases may have involved pain, pressure, seizures, ritual beliefs, or reasons we still do not understand. That uncertainty matters. Ancient people were not following one universal rule. Different groups may have that different reasons, but healed bone gives us one powerful clue. If new bone grew around the opening, the person lived long enough for healing to begin. Some skulls show long-term healing. Think about what that means. The patient survived the opening, survived the bleeding, survived the days after, and survived without antibiotics or a modern operating room. Making the opening was only the first danger. Recovery came next. Someone had to bring food, someone had to bring water, someone had to keep the patient warm, someone had to protect the wound, someone had to watch while the patient healed. So the surgeon was only a part of the system. The group mattered too. And this is where the story becomes modern. We like to imagine progress as one brilliant person suddenly inventing the answer, but human progress usually works differently. One generation makes a mistake, the next generation remembers it. A later generation makes one fewer mistake. Almost everything you trust today works like this. You are using knowledge learned by people who failed before you were born. Ancient healers were doing the same thing without books, laboratories, or medical schools. They watched, they remembered, they taught. That is cumulative human intelligence. The tools were simple, the knowledge was not. stone, hands, patience, observation, memory, and teaching became a system strong enough to keep some people alive after part of the skull was removed. That does not make the procedure safe, it makes the learning remarkable. The first healer did not need to know everything. The next healer only needed to know more. That is how a stone tool became a skill. That is how experience became knowledge. And that is how humans learn to pass survival forward. Tell me in the comments, would you trust an ancient healer with a stone tool near your skull? Subscribe to Origo Facts for the next story about the ancient mind and the modern world, and share this on WhatsApp with someone who still thinks ancient humans were primitive.